All right, today we're diving into a new strategy for treating advanced stomach cancer. And look, this is one of the toughest cancers to fight. The big question here isn't just, does a new treatment work? It's who does it work for? That's what we're going to unpack.
And that really is the heart of it, right? I mean, think about it. When we're fighting something as serious as cancer, should the approach really be one size fits all? Should a 75-year-old man get the exact same treatment plan as a 50-year-old woman? Well, the research we're breaking down today, it tackles that question head on.
So first things first, let's just set the stage. We need to understand why this research is so critical. You see, advanced gastric cancer, that's stomach cancer, is an incredibly stubborn disease to treat.
And this is the sobering reality of it. For patients with advanced stomach cancer, the standard first-line chemotherapy gives them a median survival of only about 1 year. 1 year. That number all alone tells you everything about how urgently we need better, more effective options.
And here's the real kicker. It's not just that the cancer itself is aggressive. The treatment, it can be absolutely punishing. Between the cancer progressing and the side effects, patients often just become too unwell to even receive a second round of treatment. Think about that. A staggering 60% of patients, that first shot at treatment is the only shot they ever get.
So this all leads researchers to two huge looming questions. First, what about older patients? Nearly half of all people with this cancer are over 70, but they're often left out of clinical trials. So how do we best treat them? And then, the second big unknown. Do men and women respond differently? We see it with other drugs, so does that apply here too?
Okay, so to get some answers, researchers came up with a new game plan. They designed a clinical trial called the Armani trial, and it was set up specifically to test a completely different strategy.
The concept they're testing is called switch maintenance, and the analogy here is actually perfect. Think of it like running a marathon. For the first few miles, you might want one kind of shoe to get you going, but for the long haul, you might need to switch to something more durable, right? It's the same idea with chemo. What if, instead of just pounding away with the same harsh treatment, you use it for a few months to get the cancer under control, and then you switch to a different, more tolerable drug combo that's designed to go the distance?
So here's exactly how they set it up. It's a pretty straightforward experiment. They had two groups of patients. Arm A was the switch group. They got 3 months of the initial chemo, and then they switched to a new combination of drugs. Arm B was the continuation group. They just kept going with the same chemo they started with. See? It's a really clean comparison, asking a simple question: which path works better?
All right, so the big question, what happened? What did they find? This is where we finally get the answers to those questions we started with about age and sex.
Okay, first up, the overall result. And it was pretty clear. The switch strategy was the winner. Patients who switched went almost twice as long before their cancer started to progress again. We're talking 6 to 7 months for the switch group versus only about 3 to 4 months for the group that just continued the standard chemo. That's a huge difference. A definite win for the switch.
But here's where it gets really interesting. Was this benefit the same for everybody? Was it spread out evenly? Or did certain people benefit more than others?
Well, when they drilled down and looked specifically at patients over the age of 70, the difference was absolutely dramatic. The switch strategy wasn't just a little bit better for them. It came with a 45% lower risk of death. That's not some small incremental improvement. That is a massive survival advantage for this older group of patients.
And what about the other big question? Did it matter if you were a man or a woman? Turns out, no. The trial found the benefit was just as strong for both men and women. So that gives us a really clear answer. Sex wasn't the deciding factor.
But, you know, it's never quite that simple. The picture is a little more nuanced. While the benefits were pretty much across the board, the side effects, they weren't one size fits all. Younger patients, for instance, were more likely to get that tingling nerve damage in their hands and feet. Older patients, they were more likely to deal with anemia. And women, specifically, had more issues with something called hand-foot syndrome. It just goes to show, even when you have a winning strategy, you still have to watch different patients for different problems.
And this is so important. The benefits weren't just about the numbers on a chart, you know? It's not just about living longer, it's about living better. How a patient actually feels day in and out.
That is absolutely critical. In fact, the researchers themselves put it perfectly in their conclusion. They said, and I'm quoting here, "The impact on QOL, that's quality of life, was better in Arm A irrespective of age and sex." In other words, it was better for everyone who got the switch therapy.
So what does better quality of life actually mean in real terms? It means the patients who switched, they just felt better. They had less fatigue, less nausea and vomiting. And maybe most importantly, the time it took for their general health to start going downhill was much, much longer. This is a huge win. It means more good days.
Okay, so let's pull all of this together. What's the real-world takeaway here? What does this all mean for patients and their doctors making these tough decisions? You know, when you really get down to it, it comes down to this one simple truth. A cancer treatment has two jobs. One is to fight the tumor, obviously, but the other, equally important job is to preserve the patient's strength. Because being strong enough for the next battle, the next line of defense, that is everything.
And this next number, this shows you exactly what happens when that strength is lost. For the older patients who stayed on that tougher, standard chemo, less than half of them, only 49%, were even well enough to get another treatment when the cancer came back. The standard path, it wore them out.
So this research, it really lays out a whole new path forward. Step 1, we now have a switch strategy that's not just effective, but it's more tolerable. Step 2, it actually improves how patients feel during treatment. Step 3, it keeps them stronger for longer. And step 4, and this is the big one, it keeps that door open for future treatments, giving more people, especially older patients, another shot.
And that leaves us with this final, really powerful thought. This trial shows what happens when we start tailoring treatment not just to the tumor, but to the patient's entire life journey, their age, their strength, their quality of life. And it makes you wonder, if we can do this for stomach cancer, what other breakthroughs are just over the horizon? What happens when we stop asking what works and start asking what works best for you?